Hi, I'm Linda Gowing. My field of activity is evidence-based practice in the treatment of drug and alcohol problems. I've been working in this area for a little over 10 years, and in that time I've seen an accumulation of research evidence supporting the effectiveness of different types of treatment, particularly accumulated evidence in the form of systematic reviews that collate all of the research findings. I think a challenge for us in the future is to continue to synthesise research findings into systematic reviews, but to also look at how best we can encourage translation into practice of the findings of research and systematic reviews. It can be very difficult to take the information from a systematic review and apply it to an individual patient. And that's partly because systematic reviews often focus on an intervention or a particular aspect, whereas if you're looking at what a patient needs, you might need to look at multiple systematic reviews to look at different aspects of interventions to decide what is best. And a busy clinician doesn't have time to look through multiple systematic reviews. So we need to look at how best to present that information in a way that helps clinicians make decisions about individual patients. If we start thinking about the research evidence from the point of view of different types of patients, different needs, then I think we can think better about how to combine different sorts of treatments, how to combine psychosocial interventions with pharmacological interventions, perhaps how to combine pharmacotherapies together, or even how to offer different treatments sequentially so that we are tailoring our treatments more to the life history of the person. And I think in that regard we've also got to get better at incorporating into the research evidence different types of research. Systematic reviews tend to be very focused on randomised controlled trials as the gold standard treatment, but in drug addiction, which is a chronic relapsing condition, study designs that are longitudinal in nature, that follow people over time, may give us a better idea of treatment journey, of how to connect things together that meet the needs of the individual person. And that's an area of research that I'm very interested in pursuing, of looking at how do we draw all that knowledge together, and there is masses of knowledge out there. How do we draw it together in a way that's of practical value?